As more and more people die from the opioid epidemic every day in the United States, the question remains, how do we save people from this deadly addiction? Public health officials say that MAT, or medically assisted treatment, is the gold standard for addiction treatment. Here to tell us what that means and if this is really the answer is Dr. Joseph Garbely. He's the Vice President of Medical Services and the Medical Director for Caron Treatment Centers. Dr. Garbely, thank you so much for being here.
Thanks, Julie. Happy to be here.
So what is MAT?
So quite literally, it's medication-assisted treatment, and it's medications that reduce cravings, reduce relapse risk, and therefore reduce overdose.
What are some misconceptions associated with MAT?
Well, the first misconception is that you're trading one drug for another. That's not the case at all. The medications that have been selected to become medication-assisted treatment modalities have been carefully selected to not be as abusable as someone's drug of choice.
So how does MAT differ from other therapies for drug addiction?
So the other therapies for drug addiction are talk therapies. So motivational interviewing, motivational enhancement treatment, CBT, DBT, working on co-occurring mental health issues, things of that sort is what we have traditionally used. 12-step is also part of that. A 12-step program is very much a part of that. And how medication-assisted treatment fits into that, it allows someone to become planted in treatment and reduce their cravings and also reduce their relapse risk and chance of overdose.
So what kind of medications are used in MAT?
So the oldest one is methadone. The two that we use at Caron are buprenorphine and Vivitrol. And those two medications are meant to bind to the receptors. One is a partial agonist, that's buprenorphine. The other is a pure antagonist, meaning a blocker, that's Vivitrol. And they're meant to reduce cravings. So there's these empty receptors when someone stops using their drug of choice, their opioid of choice. And those open receptors, they cause cravings. So these medications, buprenorphine, Vivitrol, block the cravings by binding to the receptors. And then someone can start doing the work of recovery.
So does that mean MAT is the entire fix, or are there other things associated to treat the addiction?
It's not the entire fix. Again, medication-assisted treatment. So the other therapies that I mentioned, plus a 12-step program, are very important going forward to access recovery for life.
And some states, including New Jersey and Pennsylvania, have recently listed medical marijuana to the list of things that can be used to treat this addiction. Do you think that's a good idea?
I don't. I was lucky enough to do a Hill briefing not too long ago, and this was my topic. This part was my topic. And what I would tell you is that we have FDA-approved medication-assisted treatment modalities. We know how to dose it. We know how often to give it. We know the side effects, and we know how to individualize it because the FDA tells us to do that. Marijuana cuts out the FDA. There are no studies that show that marijuana is helpful for medication as a medication-assisted treatment modality.
So is a person on MAT then considered sober or not?
Well, I don't like the word sober. I like recovery. And medication-assisted treatment is essential for someone to access recovery and to enjoy recovery for life. Doesn't mean they're going to be on the medication for life, but we need to get them planted in treatment so that they can enjoy recovery for life. It's a chronic disease like diabetes, so we're looking at a lifetime management of that chronic disease, and we have to get someone to a point where they can manage that chronic disease, and medication-assisted treatment helps us do that.
All right, Dr. Garbely, we'll leave it there. Thank you so much for being here.
Thank you.
If you or someone you know is suffering from an opioid addiction, or if you just want more information on MAT, you can visit Caron Treatment Centers online at caron.org.